The deadline for signing up for health insurance under Obamacare is just 1 week away. Now, if you don't have health insurance, this is the first year that you will face a tax penalty. The minimum fine is $95 a person and $47.50 for a child. That tax penalty increases next year to $325 for an individual and $162 per child. And the fine jumps again in 2016 to $695 per person and $347 per child. The implementation penalty comes at a time when there are questions about MNsure's long-term financial stability, as the exchange has struggled to meet its goals for people signing up for private plans. Those private plans are needed to keep the cost of the program down. Joining me to talk about MNsure and Obamacare is MNsure CEO Scott Leitz. Thanks for coming in.
Thanks for having me on, Esme.
All right, let's talk about the tax penalty. If someone doesn't have insurance and they sign up before the February 15th deadline, can they avoid the tax penalty?
For this coming year that they can. So if they sign up by February 15th, they'll be covered for 2015 coverage, and that will allow them to avoid the penalty for 2015. However, if they didn't have coverage last year and they're filing taxes for 2014, that would be something that they would be subject to the penalty.
And so if they didn't have it, they would still have to pay the $95 for the 2014 tax year. Yes. But if they don't sign up by February 15th, next Sunday, they'll be up for that $325 penalty, which is the minimum.
That's the minimum, or it's 2% of your income for 2015. So either $325 per person or 2% of your income. So if you think about it in terms of a person making $60,000, that's a $1,200 tax penalty, and that's real money.
That's definitely real money. And then there are additional penalties for children. Do you think people understand that?
Well, I think that's one of the things we're trying to educate people about. And we're going to be, have been stressing that, and we're going to continue to stress that in our messaging out to individuals, that they understand that they have a requirement to have health insurance coverage. And not having that coverage really does carry a penalty, and the penalty is increasing, as you mentioned in your opening.
All right. In terms of access to information or to help signing up, I understand that you're going to be expanding your hours in terms of the call center.
Yeah, we're in the last week of open enrollment. It closes a week from today. And this week, all during the weekdays, we'll be open from 8 a.m. until 10 p.m. in our call center. And then next weekend, which is the closing of everything, we'll be open from 8 a.m. until midnight. So we want to make sure that people are able to reach us, get their questions answered, get into that coverage so that they can avoid that penalty.
If they're in the pipeline, on midnight of next, Monday morning, will they still be okay or not?
Yeah, well, we encourage people to come in before midnight of next Sunday, but certainly people who are in the process of getting into that coverage, we'll make sure that they're able to complete the process and get that coverage that they need.
Okay. All right, for the long term, though, for MNsure to be solvent, you need people signing up for private plans, and you folks have not met the initial projections. In early 2014 you said that you wanted 100,000 people signed up for private plans, and right now it looks like you only have 47,000.
Well, we did some we were able to look at actual data. One of the things that we weren't able to do previously is actually have information about how many people were enrolling. So we now have a year's worth of information. We were able to project what we think we'll need to have for enrollment during this open enrollment period and over the course of 2015 to make our business a viable one. We're on target to meet those goals right now. And
well, you reduced the 100,000 projection to 67,000.
We did reduce it down to 67,000, but that will allow us to continue the operations that we need to do to really have a robust business.
Are you going to have 67,000 on private plans by next Monday?
We fully anticipate having that. One of the things that we saw last year that we anticipate seeing again this year, and that other states have experienced, is that you do see that surge last week as people put off getting coverage until the very last minute. And we saw that last year. We anticipate seeing it again this year.
All right, let's talk about the $85 million MNsure is going to be getting for IT fixes. I think there are a lot of taxpayers going, really, after all the effort and the money that's been put into the website, you need another $85 million to fix it? I mean, how can you justify that?
Well, we're really pleased with the opportunity to be able to build out a system that continues to serve Minnesotans well. This year's rollout was much, much smoother than last year, but there are certain functionalities that we really need to fully be able to complete our work with both consumers and our business partners, health plans and others. This money is going to really be used to accelerate that build out, make sure that we're able to meet the needs of everybody for next open enrollment period. So we're really excited to be able to do that.
And quickly, today's Pioneer Press is quoting Governor Dayton as saying that MNsure's finances, quote, quote, start to get wobbly in 2016 and 2017. I mean, is this something that is going to work from the financial long-term perspective?
Yeah, we certainly believe it is, and we're, as I mentioned, we're on target to meet our budget goals right now. It's important to remember that that's not just based on enrollment, but it's also based on what level of premiums coming in and how long people stay enrolled. So there's a number of factors there, and we're feeling good about where we're at right now.
All right, and we do have a link to your website and that hotline that's going to be open longer hours on our website. So thank you so much for coming in. We appreciate it.
Thank you for having me.
All right.